A stroke is about 2%, 1% here with us, okay? Pacemaker is number 3. There's a 10% chance of getting a pacemaker, and that's because right next to the valve there's a nerve. So when we open up the valve, it can pinch that nerve, and it happens 10% of the time, okay? We will know within the first 48 hours, the first 2 days, okay? And if you do, we just put a pacemaker. They used to be big and bulky, now they're pretty small. So it should be, if you fall under that 10%, it's relatively simple to get a pacemaker. It's not a big deal. And then number 4 is something called a perivalvular leak. The valve is here, the heart squeezes and blood goes out. Some blood can leak back into the heart, okay? Most of it, 95% of the time, is very little leak. What we call non-trace or mild, so we don't care, it doesn't mean anything. There's about a 4 to 5% chance that you can have more than that, okay? If you do, we usually monitor it, and if you're not having symptoms and it's not bothering your heart, we leave it alone, which is the majority of them. We have had, out of 500 that we've done, 3 cases that we've had to come back and put another valve in, okay, inside that valve, okay, to fix the leak. But like I said, it's really rare, but if it does happen, it's
so these are kind of worst case things, or small percentage that stuff happens.
Most patients feel really well. They really do. Especially if it's done through the groin. Some of the patients, the moment they wake up, they'll tell you, I did not realize that this was bothering me this much.
Yeah.
Okay. We do 90-year-olds often. The oldest we've done is 97.
There you go, Dad.
Okay, and you're in pretty good shape. You're in pretty good shape, and you probably would do very well. You would be a very good candidate for this, okay? If we did nothing, we ignored it, 50% chance of dying within 2 years of having symptoms, which are not very good odds.
So in other words,
2 years of what?
So if we did nothing about it, 50% chance that you would die within 2 years.
Oh, that's not good.
No.
I agree.
It's not the outcome we're looking for.
That's not good.
Yeah.
I agree with that.
Your dad was 97, and if he hadn't broken his hip, he would still be kicking around.
We're on the same page.
Yes.
Okay. So, you know, it takes a little bit of time. It takes on average about 6 to 8 weeks to get you done.
Back.
Okay. We need to get a lot of studies done. Once we get all those studies done, you come back and you see a second surgeon. 2 surgeons have to agree that you're not eligible for the open heart surgery. Okay. And then we'll get you scheduled. That's the way it works.
Okay. So we're talking a 6 to 8 week window.
Yeah, 6 to 8 week window to really have you in the operating room.
Would you be doing this procedure?
It'll be me, Dr. Goldman, Dr. Ganal, Dr. Cody. There'll be 4 doctors in the room.
Wow, 4 doctors.
1, 2, 3, 4.
There you go. And another one for your head.
Yeah. There'll be somebody else up there, actually.
Yes.
The anesthesiologist.
Yeah, that's what my brother does.
My son's a doctor.
Yeah.
Good.
He's an anesthesiologist, actually.
Anesthesiologist.
Good.
Yeah.
So you keep Scott informed?
Oh, I will. Not to worry.
If we do them through the groin, okay, we do them through the groin, most of them, we're doing them awake now. You don't even have to undergo anesthesia. Okay, but that's only for the groin, and that would depend on the anesthesiologist. He will make the decision at the time of the procedure, but most of them are being done awake now with just
sedation.
A little local anesthesia.
Oh, just local anesthesia. Oh.
Yeah. Okay.
Excellent.
Good.
Sounds good to me.
Okay.
We'll get you.
So we got to get a CAT scan.
We'll get
and
all
you're
that
gonna.
stuff.
Okay.
We'll get all that settled for you. Can I listen?
Yes, sir.
Do you want to put the cane down? Here. You don't need that right now.